Welcome to CCED Seminars, the worldwide destination for online chiropractic CE. You're about to begin a professionally produced, evidence-based chiropractic continuing education journey designed to support clinical excellence, license compliance, and lifelong learning. Let's begin now.
Hello, doctors. I'm Dr. Donald Ozello, Championship Chiropractic in Las Vegas, Nevada. First of all, I want to make sure everyone can hear me. So if you can hear me, please raise your hand. All right. Thank you very much, doctors. I greatly appreciate that. We have a lot of information today. Going over the elbow, forearm, wrist, and hand. A lot of videos. Like Dr. Horn said, there's going to be 21 videos. The videos are mostly adjusting videos, but there are videos on some soft tissue work and also on some joint mobilization. As we know as doctors of chiropractic, personally keeping our hands healthy so that we can have a long career is very important. And, anyone who uses their hands for their work, doesn't matter if it's a chiropractor, massage therapist, if they're an athlete, if there's someone who spends time on the computer, if they're landscapers, they need to have healthy elbow, wrist, and hands. That's why learning these techniques and treating those areas are so important. There's patients who I've treated who they've been going to the chiropractor for 5, 10, 15, 20 years, and they never had their extremities adjusted. And I think it's so important that we give these people complete care, that we work the entire kinetic chain all the way from the neck, the upper mid back, shoulder, all the way down the arm. So let's go ahead and get started. As most of you know, if you've taken my class before, I like to start with a chiropractic testimonial. This one comes from Mr. Bill Romanowski. He is a 4-time Super Bowl champion and played in 243 straight games. Now that to me is incredible. That's more impressive than being a 4-time Super Bowl champion to me. Chiropractors, as far as I am concerned, are amazing. And I think they have helped me considerably in the past year that I've started seeing them on a consistent basis. So that's a huge compliment and a huge testimonial thumbs up for our profession. What we're going to go over today, we're going to go over the anatomy and physiology. We're going to go over some in-office chiropractic treatment, obviously chiropractic adjusting technique, soft tissue work, and stretching. The areas of the body that we're going to hit: the elbow, the forearm, the wrist, and the hand. In the anatomy part, we're going to start with the tricep muscles. The first thing I just want to talk about here is just really the insertion, because we're going to go over some soft tissue work for the insertion in the second hour of the class. The 3 heads of the tricep combine to form a single tendon distally. The olecranon process of the ulna and the forearm fascia are where they insert. Now, I'd like to say, if you look at the information and you see these little numbers, say like you can see on this, it says 11 and 12. This information is taken from reference articles number 11 and 12. If you look at the notes, the reference articles are in the back of the notes. The reference articles contain the name of the article, the date of the publication that they were in, the author, and a link to that article. So you can look up that article and get additional information. The concentric action of the triceps is elbow extension. With the shoulder adducted, the triceps help hold the humeral head in the glenoid fossa, and the long head assists in shoulder extension and adduction. And it's innervated by the radial nerve, which is C6, C7, and C8 vertebral levels. And you could see here is a nice picture of the triceps, shows us the origins, the origin and the insertion. Now the biceps brachii. Again, I just want to go over the insertion because we're going to do some soft tissue work on the biceps brachii in the second hour. The insertion is the radial tuberosity and the forearm fascia as the bicipital aponeurosis. Concentric actions are elbow flexion, elbow supination, and it resists dislocation at the glenohumeral joint. It is innervated by the musculocutaneous nerve, which is vertebral levels C5 and C6. And you can see we have a nice picture of the biceps brachii. And now staying with the muscles, but moving down into the forearm, talking about the posterior forearm muscles. The superficial posterior forearm muscles are the anconeus, the brachioradialis, the extensor carpi radialis longus and brevis, extensor carpi ulnaris, extensor digitorum, and extensor digiti minimi. And then the deep muscles are the abductor pollicis longus, the extensor iliacus, the extensor pollicis longus and brevis, and the supinator. The wrist extensor muscles generally originate on or on or near the lateral epicondyle and insert on the distal forearm or into the posterior hand. The main actions of the posterior forearm muscles are wrist extension and forearm supination. Superficial extensors can suffer from an overuse injury known as lateral epicondylitis, which is also known as tennis elbow. The extensor carpi radialis brevis, extensor carpi radialis longus, and extensor carpi ulnaris act synergistically based on each muscle's insertion in dynamic function. Now, if we look on this one, you can see a very good picture of the common extensor tendon. Now we move to the medial epicondyle. The medial epicondyle is the common origin of the wrist flexor and forearm pronator muscles. The pronator teres, the flexor carpi radialis, the palmaris longus, and the flexor digiti superficialis originate on the medial epicondyle and are innervated by the median nerve, while the flexor carpi ulnaris also originates on the medial condyle, but it is innervated by the ulnar nerve. Muscles that share the origin site form the common flexor tendon of the medial epicondyle of the humerus. Tendon is approximately 3 centimeters long and crosses the medial ulnar humeral joint. It runs parallel to the ulnar collateral ligament, where it serves as a secondary stabilizer. So here's a nice picture of the common extensor tendon. All right, now we get into the wrist. The wrist is one of the most complex joints in the body. There are 8 carpal bones, 2 forearm bones, 5 metacarpals. The number of articulations and degrees of motion in the wrist are extensive. Numerous ligaments and tendons connect and provide structural stability and movement of the hand and wrist. All right, the carpal bones. The bones of the wrist that connect the distal aspect of the radial and ulnar bones of the forearm to the basis of the 5 metacarpal bones of the hands. Again, there are 8 carpal bones, 2 rows, the proximal row and the distal row. The proximal row from radial to ulna is the scaphoid, the lunate, the triquetrum, and the pisiform. And then the distal row from radial to ulna is the trapezium, the trapezoid, the capitate, and the hamate. And now we have on this line, we have 2 nice pictures of the carpal bones. And then when we speak about the proximal row of the carpal bones, you have the scaphoid. It has a boat-like appearance. It forms the radial border of the proximal carpal row. Most of the surface is covered by articular cartilage, allowing it to bridge the joint between the 2 rows of the carpal bones. Next, we have the lunate. The lunate is crescent-shaped. It's located between the scaphoid and the triquetrum, and it lies near the median nerve. Now remember that we have poll questions, so I am helping you on one of the poll questions. The lunate bone lies near the median nerve. The triquetrum is pyramid-shaped. It articulates with the pisiform lunate and hamate